A very warm good morning to you. If you've just joined us, this is the South African Morning. We get to this now, where today is World Heart Day. And according to the World Heart Federation, cardiovascular diseases are the top cause of death in the world. Now, in South Africa alone, about 225 people die each and every day from heart diseases. Now, they're caused by lack of exercise, poor diet, diabetes and smoking. This just amongst other things. But to discuss this more, we're joined by cardiologist, that's Brad Griffiths. Mr. Griffiths, thank you so much for your time. Welcome to the South African Morning. Quite an important, topic to highlight here, given that it's World Heart Day. But let's just talk about some of the facts around heart diseases, particularly in South Africa. I think one of the myths that I would like you just clarify is whether or not this is more of a male disease, or can females also have heart diseases?
Good morning. Thank you very much for having me on the show. Yeah, no, there's no doubt that heart disease affects males and females almost equally. It does tend to affect females a bit later in life, but it's not something that we don't see in women. And so certainly both men and women do need to be alert to the symptoms of heart disease.
And what causes heart disease? Is it more inheritary or not? What causes it?
Well, it's a combination of factors. You can determine your risk of coronary disease by looking a little bit at your family history. There is a genetic predisposition in some people, particularly if you have a parent or a sibling who developed a heart attack or angina before the age of 55. And then there are what we call the modifiable risk factors, which you've mentioned some of them already. High blood pressure, diabetes, cholesterol, high blood cholesterol, should I say, smoking and lifestyle. Those are the main contributors to developing heart disease, and those are the things we focus on in preventing people developing heart disease in their lifetime.
And with that being said, is there an age criteria where, heart disease is most prevalent, or can you have this, particular disease at any age, any time in your lifespan?
So it depends what type of heart disease we're talking about. The most common type of heart disease is what we call the atherosclerotic, or due to hardening of the coronary artery. That's what causes angina, that's what causes heart attacks, and that's the most common heart disease that people develop. But that will usually develop later in life as you age, particularly into the 70s and 80s. But we do see it earlier in people who have those established risk factors. So, as I said, under the age of 55, there's usually some sort of predisposition, but definitely in people with a combination of those risk factors. The more risk factors you have, the higher your overall risk becomes. They are additive. Then in young diabetic with high blood pressure and smoking, we do see acute coronary events fairly frequently, and that's why we target those in terms of our prevention strategies.
So what I find also quite concerning here is that if these numbers are correct, they tell us that 225, that's the number of South Africans that die each day of heart disease. Perhaps you can even clarify this for us, but also in the context of COVID, what numbers are you seeing? Have you seen more deaths during this pandemic with regards to heart diseases, or has that number kind of shifted a bit?
That's a very good question. I think the first message that we need to get across is that despite COVID, heart disease is still going to be the #1 leading cause of death in the world this year. And heart disease, prior to COVID, was the leading cause of death in the world and in the Western Cape of South Africa. And we have seen fewer admissions to hospital with heart disease during the COVID lockdown. And we haven't got good data in our own country, but in the UK, there's very good data to show that a lot of those people who would have presented to hospitals are sitting at home, having heart attacks, suffering the symptoms of heart disease, and potentially succumbing to those conditions because there's a fear of coming to hospital. It's a very important message to anybody who's watching this, that if you're developing symptoms of heart disease, you do need to be assessed by a doctor, and you do need to get those sorted out.
Yeah.
It's still going to be the leading cause of death.
And I want to touch on that, Brad, if you may allow me very quickly, because we run out of time. How do we then treat heart diseases?
So look, there's two main ways to deal with heart disease. First of all, if you've got established coronary disease, the most common cause, we have to see how many of those you have and whether that needs to be treated with some type of revascularization, stenting, or bypass operation. And the other side of it is medical therapy to both target symptoms and also to target your risk factors. Most importantly, controlling your blood pressure, sugar, cholesterol, stopping smoking, and healthy lifestyle changes. Those are by far the most important things you can do.
Right. Well, cardiologist Brad Griffiths, thank you so much for your time. Quite important the topic you're talking to us about.